Today on Experts from Denture, Artistry, Implants, Crowns, Veneers, Dr. Alex Smith is my guest. Alex, how are you, sir?
I'm doing well, Frank. How are you doing?
Doing really good, really good. You guys have had some changes to go through with the pandemic and all the extra precautions that take place, and it's impacted the business a little bit where you've made some adjustments, and one of those is something called flex time. This is really interesting. What is that concept all about?
Well, I'm glad you asked, Frank. Flex time is something that we do on a daily basis for our patients that need to be seen immediately for either an urgent need like pain, broken front tooth, denture or partial is broken. And it's also utilized for people that want to be in an office with a lower volume of people during this pandemic time that we're in.
So how does that work if a patient is looking to, hopefully not be around other patients?
Sure. So every single day we dedicate 3 hours at a time, 8 to 9 a.m. and then 3 p.m. to 5 p.m., in which we do not perform routine care. So if a patient wants to be seen as the only patient in the office or has a dental emergency, then we have the ability to get them in within 24 to 48 hours every single day. They just give us a call and we put them in our flex time for that afternoon or the following morning or the following afternoon so they can be seen pretty much immediately.
That's an amazing thing. It's almost like walk-in.
Yes, sir. Yeah, we love it.
Yeah. Well, patients have got to love that too. I mean, I did have a dental emergency with you guys, last year before this, actually right after COVID started. And I was able to get in immediately when I needed to. But this flex time deal, you have an hour in the morning and 2 hours in the afternoon every day that is basically reserved, as in kept open.
Absolutely. I mean, a lot of people can relate to that frustration where you need something done immediately. Perhaps you're having a hard time sleeping because you have a toothache and you give the dental office a call and they say, hey, the next time we can see you is 3 weeks. We just feel like that's ridiculous. We want to help our people immediately, get them in, get their problem solved, and get them back to enjoying life.
That is a really good concept and something that has been needed for a long time. That's one of the ways that you kind of put patients first. Another way is because you don't take insurance, you're not beholden to insurance companies in the way they like to work, right?
Absolutely. It's crazy to me to see things like increased fees, which is highly insurance driven for things like COVID precautions or the cost of PPE that's been inflicted on the medical profession or dental profession in general. It's unfortunate. It's necessary. But we don't pass that burden on to our patients. And a lot of that has to do with the fact that we're treating our patients to get to optimal oral health and not on any type of insurance-driven agenda.
Now, it's not that patients with insurance shouldn't come see you. They should, but you guys just don't do the billing, right?
That's exactly right. And if you do have dental insurance and your insurance will accept us as a provider, your insurance dollars will actually go farther because our fee schedule is lower. And it's a great win-win situation when we can help our insurance patients out with our lower fees. So
the fact that you're able to put patients first, not only in the manner of treatment plan that you put together for them, the walk-in times that are reserved every day, morning and afternoon, those are just great ideas. And since COVID has come along, your surgical suites where people go in and those things are like hermetically sealed. I've been in them. Those are terrific.
Yes, sir. I'm glad that you mentioned that. Before COVID, our original concept was to have a great amount of cleanliness and sterility in the office. We've always taken infection control very seriously. So anytime that we're providing any type of procedure that has aerosols that are generated, they're performed in one of our 2 surgical suites, which is behind closed doors. You will be the only person or patient in that room with the exception of the dental team, the doctor, and the assistant that's providing service. And it's all to keep people healthy and safe and prevent the spread of aerosols and perhaps, a virus or something.
All right. The place is Denture Artistry, Implants, Crowns, Veneers. Where do they find more information?
Yes, sir. You can find us online if you just Google Denture Artistry, or you could give us a call at 541-200-7798.
That's Dr. Alex Smith, Denture Artistry, Implants, Crowns, Veneers, my expert today on FM News 100, 1110 KBND.